I've reviewed the articles published in eCancer Medical Science this month, and it's a very, very rich harvest indeed, and very, very interesting topics. Interesting for me as an editor, of course, is the origin of these articles, and to my delight, one article is coming from Washington, D.C., one is coming from Houston, Texas, two very notable advanced oncology centers in the U.S. But we've got two original articles from India, we've got one from Ukraine, and we've got one from Chile, and we've got several from mainland Europe. There are three interesting case reports. One of a patient with Waldenstrom's microglobulinemia and the tumour located in the nasopharynx. Most unusual, the patient has responded to conventional therapy with Waldenstrom's. The second is a child who's 6 years old, and this child had an unusual presentation. The kid had acute lymphocytic leukemia and was treated in the conventional way for that. And on a chest x-ray there was a very unusual mass. This was biopsied and turned out to be granulocytic sarcoma. This was irradiated, which is a very courageous thing to do, and has achieved a near complete remission in terms of radiography. The child's leukemia is in remission, and we'll watch and wait. The third case report is of a patient with thymoma who 2 years after original diagnosis developed hypogammaglobulinemia, so-called Good's syndrome, after Bob Good, who was one of the pioneers of studying immunodeficiency and became the director of Sloan Kettering Cancer Center in New York. And to complicate matters further, this patient developed a red cell aplasia. This is probably, as far as we can find, a unique case report where hypogammaglobulinemia and thymoma and red cell aplasia occurred in the same patient. There is no conventional treatment, no guidelines on treating the hypogammaglobulinemia with aplasia, and so supportive care is being offered. Read all about them in ecancer.org. I recommend a couple of reviews in eCancer. One of them is on estrogen receptors. You might have thought that we know all there is to know about estrogen receptors, but if you think that, then you should ask yourself, why is it that estrogen therapy doesn't produce responses in all patients with breast cancer which are estrogen receptor positive? The answer is that there's more to the ER than meets the eye. First class review from the United States. Second review, well worth reading, particularly if you're being confronted with patients who demand to have vitamin supplements and are trying to maintain that vitamins are the cure-all for cancer and also the major prevention strategy. This is a very good, very comprehensive review of all the articles on the subject of vitamin use and the incidence of breast cancer and the subsequent evolution of the breast cancer. And the bottom line, quite quickly, is that it comes to a zero. There is really no data that supports that popping pills will stop you getting breast cancer, nor will they help you very much while you're being treated. This is a nice article from Bizzotti and Ianiarella from the European Institute of Oncology, whose journal eCancer is. We have published two very recent conference reports, one on the nursing section, predominantly nursing section, and also a lot of the patients section from the European Cancer Conference held in Amsterdam. We've already got a large number of TV interviews up on the site, which you can read. If you're interested in the nursing content, which was fairly comprehensive and forward-looking, then look at the conference report from Caruso et al. From the IEO. The second conference report, a big one in Johannesburg on palliative care. Two of the big African organizations got together to launch this meeting with 470 specialists, not just cancer specialists, of course, because palliative care goes across disease boundaries. And they met in Johannesburg over a 2-day meeting. It was important for a variety of reasons, but particularly for eCancer, because we were there testing our palliative care modules. We will be presenting at Aortic, the next big African cancer meeting, in a couple of weeks' time in Durban. About 17 modules carefully prepared with a lot of video on palliative care. And we ran these at the meeting in Johannesburg. As a result, we revised a lot of the content, and we established another large number of interviews. Our content total will be 41 palliative care experts contributing in the African problems, which are variable from region to region. The Congress in Johannesburg came up with a number of really important commitments to work together, obviously, to get proper recognition of the problem. It is the big problem in cancer in Africa, but it's a problem in a lot of other disease areas as well, like malaria and HIV/AIDS, etc. To continue to develop resources, to develop infrastructure, to work together, to start concentrating a good deal more on palliative care in children who tragically still die over frequently in Africa. Really good conference report, very thorough, and I commend you to it. John Dining is the author.